Hi, my name is Dr. Anj Singh and I'm an NHS doctor and a media medic. I'm going to take you through a series of common medical questions that people often ask me. In this video we're going to talk about how to treat piles. Piles are also called hemorrhoids and it's an embarrassing problem, but it affects anywhere up to 25% of the population. It's especially a problem in pregnant women or those over the age of 45 years. Piles are actually engorged or dilated blood vessels in and around the anus and the rectal region, and they happen because of excessive straining whilst trying to go for a poo. Sitting on radiators or sitting on cold slabs of stone are just old wives' tales. They are not going to cause piles. Piles can either be internal or they can be external and actually visible, and in the vast majority of people they tend to be asymptomatic. Sometimes they can cause pain and discomfort, or they may cause a localized itching. Most of these will actually get better by themselves without treatment, especially if they're mild, but if they're problematic or if they're severe, then you can get treatment. This video is going to take you through some of the things that you can do and also some of the treatments that are currently available. First and foremost, having a good diet is very useful. That helps to prevent constipation and therefore results in less straining whilst on the toilet and will reduce your chances of actually getting hemorrhoids. When wiping after going to the toilet, it may be a good idea to use moist tissues or wet wipes, purely because dry tissues may cause localized irritation. There are lots of creams and ointments available to treat piles. These contain a variety of medications but should not be used for long periods of time. Because some of them contain the same thing, try not to use more than one product at the same time. They are designed just to treat or soothe the swelling and the inflammation and the local irritation that you get. They will not get rid of the piles. Finally, laxatives are quite useful because they make the poo soft and make it easier to pass. You have to strain less whilst on the toilet. If your piles or hemorrhoids are persistent or particularly problematic, then you should always see your doctor to see if there are other treatments that may be available. And we're going to go through those here. One of those treatments is called banding, and that's where an elastic band is applied to the base of the pile to cut off its blood supply, encourage it to shrink and eventually drop off. Sclerotherapy is a technique where the pile itself is injected and it becomes hard and shrinks after that. Another technique called infrared coagulation is where a special device is used to burn and shrink the pile tissue itself. And last but not least, there is always the option of surgery, particularly for internal piles or those that are especially large. If you suffer from piles and they become extremely painful, then it's a good idea to get them checked because they may have developed a clot within them, and that requires specific treatment in itself. That's how to get rid of piles.